Okay, this is Chapter 7 of the ATI Community Care of Vulnerable Populations. Community health nurses identify specific populations and implement measures to improve health through direct care or improving healthcare access, and by changing the physical environment, healthcare culture, and health policies. Community health nurses care for many individuals who are members of specific populations and more prone to impaired health or negative outcomes associated with illness and disease. Factors that can threaten health: low income, difficulty accessing health care, uninsured or underinsured, poor self-esteem, racial and ethnic minority status, discrimination. Specific populations. There are populations that have multiple risk factors for negative health outcomes. Some populations include individuals who are subject to issues such as the following: violence, substance use disorders, mental health, rural residency, migrant employment, veteran status, and disability. Health disparities is significant differences in health status and access to health services across varied groups. Health disparities can be linked to preferred sexual orientation, ethnicity, race, education, and income differences. The Healthy People Initiative has a goal to eliminate disparities to achieve health equity. Goals to address for individual populations include the following: increasing the number of people who have a routine primary care provider, increasing the number of people who have health insurance, reducing the number of people with disabilities who report physical barriers to accessing health and wellness programs in the community. Nursing actions: advocate for social justice and the elimination of health disparities, create rapport with and provide a safe environment, facilitate care coordination among providers, advocate for the needs of the population, developing an interpersonal professional network to assist with improving the health of the population. Violence. Types within the communities. Homicide. Homicide is often related to substance use. Most homicides are committed by someone known to the victim and occur during an argument. Violence often precedes homicide within families. Rates of homicide are increasing among adolescents more than in older age groups. Assault. Males are more likely than females to be assaulted. Youth are at a significantly increased risk. Rape is often unreported. Most incidents of rape are spousal or acquaintance date rape. Females are more likely than males to be raped. The risk of rape is increased in cities between 8 p.m. and 2 a.m. on the weekends and in the summer months. Human trafficking is a significant global health issue, including in the United States. It affects all races, ages, and genders, but women and children under the age of 18 are at an increased risk. Understanding the issue and the available supports can be key to saving lives. Suicide. According to the CDC, rates of suicide are highest among individuals 35 to 64 years of age. Females are more likely to attempt suicide, however, males are more likely to complete suicide. Caucasians are more likely than other ethnic groups to commit suicide. Risk factors for suicide include depression or other mental health disorders, substance use, having access to a firearm, and partner violence or neglect issues. Physical violence occurs when pain or harm results toward an infant or child, as in this case with shaken baby syndrome, towards a spouse or partner, such as striking or strangling the partner, towards an older adult in the home, such as pushing an older adult parent or causing her to fall, toward a non-spouse or non-partner. Sexual violence occurs when sexual contact takes place without consent. Emotional violence includes behavior that minimizes an individual's feelings or self-worth or humiliates, threatens, or intimidates a family member. Neglect includes the failure to provide the following: physical care, such as food, shelter, and hygiene; emotional care and/or stimulation necessary to achieve development milestones, such as speaking and interacting with a child; education for a child; needed health or dental care. Strategies to reduce societal violence. Primary prevention. Teach alternative methods of conflict resolution. Organize parenting classes. Educate clients about community. Assist in removing or reducing factors that contribute to stress. Teach individuals that no one has the right to touch or hurt another person. Secondary prevention is identify and screen those at risk for abuse. Assess and evaluate any unexplained bruises or injuries. Screen all pregnant women for potential abuse. Refer sexual assault or rape survivors to a local emergency department. Tertiary prevention. Establish parameters for long-term follow-up. Make resources in the community available to survivors. If court systems are involved, work with parents while the child is out of the home. Provide grief counseling to families following the death. Support and educate the offender, even though a report must be made. Caring for clients who experience violence. Build trust and confidence with the client. Focus on the client rather than the situation. Work with the client to develop a plan for safety. If abuse is suspected or has occurred, complete mandatory reporting following state and agency guidelines. Substance use disorders. Substance use disorders involve the maladaptive use of substances resulting in threats to an individual's health or social and economic functioning. Substance use disorders have significant effects on family dynamics and often lead to codependency. Substance use disorders negatively affect family life, public safety, and the economy. They cause more disability, death, and illness than any other health condition. Recovery from substance use disorders occurs over years and usually involves relapses. A strong support system, including 12-step programs and self-help groups for family members, is important. Dependence is a pattern of pathological compulsive use of a substance and involves physiological and psychological dependence. Cardinal indicators of dependence include denial, defensiveness, lying about use, minimizing use, blaming or rationalizing use, or going with the flow. Alcohol use. Alcohol is the most commonly used substance in the United States. It is socially acceptable as well as easily accessible. Alcohol is a depressant. Alcohol dulls the senses to outside stimulation and sedates the inhibitory centers in the brain. People who frequently and consistently drink alcohol develop a tolerance at an increased requirement for alcohol to achieve the desired effect. The direct effect of alcohol is determined by the blood alcohol level. The body processes alcohol dependent on several factors: size and weight of the drinker, sex, carbonation, time elapsed, food in the stomach, type of alcohol. Excess alcohol that is not metabolized circulates in the blood and affects the central nervous system and the brain. Withdrawal. Following prolonged use, manifestations of alcohol withdrawal appear within 4 to 12 hours. It is important to determine the time of the last drink the client ingested in order to accurately monitor for manifestations of withdrawal. Manifestations of withdrawal are irritability, tremors, nausea, vomiting, headaches, diaphoresis, anxiety, tachycardia, and elevated blood pressure. Smoking is the most important preventable cause of death in the U.S., according to the CDC. Nicotine is a stimulant that temporarily creates a feeling of alertness and energy. Repeated use to avoid the subsequent down that will follow this period of stimulation leads to a vicious cycle of use. Tolerance to nicotine develops quickly. E-cigs have gained popularity in the United States among adolescents and contain liquid nicotine that is heated into a vapor and inhaled. Cigarette smoking results in deep inhalation of smoke, which poses the greatest risk of cancer. Cigar pipes and smokeless tobacco increase the risk of cancers of the lips, mouth, and throat, and passive smoking, which is exposure to secondhand smoke, poses considerable health risks to non-smokers. Other substances: marijuana, other stimulants, other depressants, opioids, hallucinogens, and inhalants. Marijuana has a low level of toxicity. Although it is legal in some states, it is considered the most commonly used illegal substance in the U.S., where it can develop tolerance and dependence with long-term use, but withdrawal manifestations are minimal. Other stimulants include caffeine, amphetamines, methamphetamines, and cocaine. Other depressants include barbiturates, benzodiazepines, chloral hydrate, and GHB. Opiates include morphine, heroin, codeine, and fentanyl. Hallucinogens like psychedelics produce anxiety, paranoia, impaired judgment, and hallucinations. Some examples are lysergic acid, LSD, herbs, PCP, and MDMA, which is ecstasy. Inhalants are volatile substances that are inhaled, huffed. Death can result from acute cardiac dysrhythmias or asphyxiation. Establish rapport with the client. Pose questions in a matter-of-fact tone. Be non-judgmental. Communicate that the purpose of questioning is because of the effects that different practices can have on individuals' health. Seek information about specific substances used. Elicit information about consequences. Discuss the individual's history of previous rehab experiences. Okay, strategies to reduce substance use disorders. Primary prevention. Increase public awareness, particularly among young people, regarding the hazards and risk of dependence. Encourage development of life skills. Assist in formation of parental action and awareness. Secondary prevention. Identify at-risk individuals and assist them with reducing resources of stress, including possible referral to social services to eliminate financial difficulties and screen individuals for substance use disorder. Tertiary prevention. Assist the client with developing a plan to avoid high-risk situations. Refer the client to community groups. Monitor pharmacological management. Provide emotional support to recovering substance users. Mental health. NAMI, National Alliance for the Mentally Ill, is an advocacy group that works to reduce stigma and provide services for clients who have mental health disorders and for their families. Individuals who have severe mental illness can experience stigma, marginalization, lack of social support, and inadequate treatment. Mental illness is complex and influenced by multiple individuals and community factors. Therefore, it requires a variety of nursing strategies. Factors affecting mental health: individual coping abilities, stressful life experiences, chronic health problems, stigma. Strategies for improving mental health: primary prevention. Provide education to populations regarding mental health. Teach stress reduction techniques. Organize bereavement support groups. Secondary prevention. Screen to detect mental health disorders. Work directly with at-risk individuals. Conduct crisis intervention. Tertiary prevention. Perform medication monitoring. Provide mental health interventions. Make referrals to various groups of professionals. Maintain the client's level of function to prevent relapse. Assist the client in planning. Educate the client and family regarding medication, adverse effects. Migrant employment. Seasonal and migrant workers are often employed in farming. Employment occurs during the time period required for caring for and harvesting crops. Agricultural workers are not covered under common labor laws. Minors 12 years old and older are not covered under Child Labor Act and can work alongside family members even under hazardous conditions. The Migrant Health Act provides funding for migrant health centers across the U.S., which serve about 1/5 of the migrant worker population. The nurse should use cultural competence to design care for individuals and groups of seasonal and migrant farm workers. Pesticide exposure. Pesticide exposure is a significant problem among farm workers. They get headache, dizziness, dyspnea, confusion, irritability, and complications as long-term exposure is linked to cancer. Issues in migrant health: food insecurity, inconsistent income with yearly cycles of unemployment, less access to dental, mental health, and pharmacy services, discrimination, behavioral health issues, harassment, and sexual abuse. Strategies for migrant health care: primary prevention. Educate clients regarding measures to reduce exposure to pesticides, teach clients about accident prevention, and mobilize preventative services. Secondary prevention. Create testing programs for TB and prenatal diagnostic testing. Implement screening programs. Mobilize primary care and emergency services. Tertiary prevention is treat for manifestations of pesticide exposure. Promote rehab after work-related musculoskeletal injuries. Educate clients who have diabetes or anemia regarding appropriate nutrition. Veterans. The Department of Veterans Affairs estimates there are 21.8 million veterans in the U.S. Approximately 2 million are women. 9.9 are over the age of 65. Veteran health issues is mental health, substance use, suicide, infectious disease, exposure to herbicides, traumatic brain, traumatic amputations, cold injury, military sexual trauma, visual impairments. Strategies for healthcare. Coordinate referrals to available veteran resources. Advocate for continued strengthening of the Veterans Health Administration healthcare system. Assist clients with the transitioning from active duty to veteran status. Ensure continuity of care between acute and outpatient settings. Develop partnerships with local agencies to strengthen resources and achieve mutual goals. All right, disability. Disability indicates a factor in the body, senses, or mind that affects the way a person interacts in the daily environment. Exact definitions are determined by specific agencies and groups based on data collection needed. Individual or group living environments, unsanitary conditions, poor nutrition, stress. Clients who have disabilities can use different terminology to describe their condition. About 1/5 of the U.S. population reports having a disability. The Americans with Disability Act was the initial legislation to promote rights for individuals who have disabilities. Effects of disabilities is cost of chronic management, decreased employment rates, decreased household income, isolation and possible self-image issues, increased risk for abuse, presence of comorbidities. Other at-risk populations: immigrants, refugees, and pregnant adolescents. Incarcerated population, increased risk of mental health disorders, lesbian, bisexual, and gay, transgender can face barriers to adequate health care, state variation in rights for benefit and adoptions. The national health goals is to increase survey and monitoring systems that include standardized questions to allow individuals to identify sexual orientation, gender, and pronouns, reduce alcohol, adult tobacco, and illicit drug use. The nursing actions is advocate increasing access to care, support the development of maintenance of healthy families, and provide opportunities and safe environments for clients to discuss care concerns.